Hi, everyone. Thanks for joining this session today. My name is Jay Shah. I am an assistant professor at University of Toronto in the Department of Physical Therapy and the Institute for Health Policy Management and Evaluation. And I also work as research director for AI ethics in health in our Joint Center for Bioethics at University of Toronto. And I also have an appointment as a scientist at Women's College Hospital. Now, the title for this session is Health AI and What It Means for You. And the purpose of this session is to introduce artificial intelligence as it's used in healthcare and pose a few questions for you all to think about as you begin to encounter and experience and think about AI in healthcare and public health now and into the future. So, a little bit more about me and how I approach this topic. I trained as a physical therapist many years ago and spent a few years doing home and community care, going into people's homes and supporting them to primarily remain healthy and independent in living at home. And that really anchored my sort of focus and thinking in healthcare delivery and health systems. I then did a PhD and started to do research about health innovation, paying special attention to ethics and social justice around new technologies and new ways of delivering care. And that is what brought my attention to artificial intelligence as it really began to become popular sort of 7 or 8 years ago. And I'm giving this talk today from Treaty 13 territory at my home, where I live with my wife and our two daughters. And it's a real privilege to be to live and to work here in Toronto on Treaty 13 territory. So I'll start with just a couple of disclaimers. I've already said a little bit about how I approach this topic focused on ethics and social justice. I don't have any conflicts of interest in relation to this topic. I've used lots of visuals throughout this talk. They're not endorsements of anything in particular, and they're all linked or cited on the slides. I'm recording this session in March of 2025, and there will be an update coming. And on that note, I would love to invite your feedback about what you hear in this session. So there's an email address here shown on the slide, health.ai.feedback@gmail.com. You can feel free to pause the video and write that down, or perhaps just open up an email in another browser and begin to write notes and questions in there if you'd like. The plan will be to collect that feedback and work with two community members who I'll talk about a bit more on the next slide to think through how to improve this session and make it even more understandable and accessible and useful for patient partners and community members in Canada and elsewhere in the world as well. So huge thanks to the two community members who have helped to provide input on what makes sense and what doesn't in earlier versions of this presentation. Bernadette Rilaraza and Kadeen Bankasingh have been really, really important for shaping how the presentation looks. And huge thanks to the Ontario Spore Support Unit, which of course is an enormous champion for patient partnership, patient engagement, and community engagement in health research and healthcare. So on to an outline for what I'll be talking about today. We'll start with a brief description of some uses of AI in healthcare, just to anchor us in some practical examples. Then I'll talk about data, and this is something that came up in some of the conversations preparing for this session as a topic that would be really important to raise everybody's awareness around the fact that we make data when we interact with the computer and services and other things, and that's important for us to keep in mind. Then I'll spend a fair amount of time talking about what is AI. And so, I'll elaborate on that further when we get there. And I'll end this session by talking about why it matters to you or why it should matter to you. And that's really about introducing a handful of questions that you might want to ask as you're thinking about specific uses of AI in healthcare. So on this slide, I also have this Venn diagram that shows ethics, health, and AI. And I want to just talk about this for a moment because it shapes how I think about or how I work on this topic. I think that doing good work, having expertise on what AI means in healthcare sort of depends on these three different areas of expertise. One is around ethics and kind of understanding how and why things matter in healthcare, how and why this technology matters in healthcare. And I've done a lot of work in studying on that topic. The second is around healthcare and health systems. I focused on that topic in my PhD, and so have some expertise on that one. As far as artificial intelligence goes, I don't have a PhD or a degree in computer science or artificial intelligence. Rather, I feel that I have a sophisticated lay understanding of artificial intelligence as a technology. And I think that's important to emphasize because it serves as an invitation. If you read up, you pay attention to the news articles that come out, attend sessions like this one, then you can learn quite a lot about what AI is as a technology and some of the issues that surround how it's used in healthcare. So you can develop quite a strong understanding of the technology and then participate in conversations about AI. Work with people in the healthcare system to better understand what community members and patients are looking for and what they need to know as AI is being used in healthcare. So that's sort of an invitation to engage with the topic. In the slides, there's a progress indicator at the top showing how we're progressing through these topics, listed 1 to 4 on this slide. And I've invited us, you all viewing this, to pause the video at different times and reflect on what you've heard, maybe write down some questions, and just think a bit more about kind of letting your thought process catch up to where you're at. I think that's an important part. I do that when I'm watching videos and attending sessions like online like this. So I've invited us to do that throughout. Okay, so we'll jump in. What are some examples of AI in healthcare? And I've listed a few here we'll kind of walk through. A first example is suggesting a diagnosis from an image. So there's a kind of artificial intelligence that can look at or read the data that's in an image like a chest X-ray and help healthcare providers to understand if there's a particular diagnosis there. Like, for example, if something seen on the X-ray may indicate cancer or not. So that's an example of AI in healthcare. Another sort of different example is predicting recovery. If there's a patient in the intensive care unit and they're on life support, or there's all kinds of data being generated about how their condition and so on, that data can be used to predict how well they'll recover or when they'll recover. That's another application of artificial intelligence. AI can be used to summarize in words a visit with a healthcare provider. So you may have been asked in a healthcare encounter, is it okay? The healthcare provider asking, is it okay if I use my phone to listen in to our conversation so that it can help make my job easier when I need to write all of this down in the record? And that's something called AI Scribe, where it can audio record your conversation with your healthcare provider and then automatically enter that information into the electronic health record. And as you can imagine, that saves healthcare providers an enormous amount of time. So summarizing visits and helping to develop a plan, that's also an important way that AI can be used in healthcare. Predictions will be a theme throughout this session. So better predicting emergency room staffing needs, for example. And this is something that hospitals have historically struggled with. How many nurses, how many doctors do I need in the emergency room on Sunday morning? It changes over time. So depending on what's happening in the area, predicting the number and kind of staff in the emergency room that are needed is also an application of artificial intelligence. Uh, Another is providing health-related advice. And I'm sure you've heard lots about, for example, ChatGPT as a sort of a website that you can enter type text into, and other kinds of inputs like pictures, and ask questions, and it responds in written word and by sending pictures back as well. So these kinds of chatbots are really remarkable applications of artificial intelligence or types of AI. Some of these different websites or chatbots are able to give health-related advice as well. That's a topic that's really just emerging and is something that we all need to be very careful with as well. Certainly, if we have questions about how we understand what's coming from a chatbot, that's something we need to talk to our healthcare providers about. And a final example outside of healthcare delivery per se, but more about medical research, AI can be used to sort of suggest particular kinds of new medicines that can then be tested in the sort of usual way to make sure that they work and that they're safe. So I give this overview of examples of AI in healthcare, partly to say, like, look at the wide variety of things that AI can do. It's hard to talk about AI as being a single thing in healthcare because it can do so many different things. So these are some ways that it may already be being used in healthcare that you encounter in these ways. So this is a time where I would invite us to pause and perhaps think about, have you heard about other uses of AI in healthcare? Are you comfortable with these uses of AI in healthcare? And what questions might you have at this point? So I would suggest you maybe make note of those, think about them, perhaps write them down, perhaps put them in an email for feedback, and we'll continue again in a moment. Okay, so we will continue on here, moving on to the sort of second section of our talk where we're addressing this topic of data. And data is, as you may have heard, is seen as like the fuel for AI. The reason that AI has become so powerful in the last 10 years is in large part because of the huge amounts of data that are available and can be stored and shared to be used in the development of these AI models. And so I want to bring this back down to, to us. When do we make data? What are all the different ways that we leave data on the computer and out there in the world? And I mean, the answer is that there are many, many ways. Whenever we interact with our smartphone, we're making data about which apps we use, how long we use them for, things like that. If we enter information about ourselves into an app, then that data gets stored somewhere. Same with our computers, a laptop, if you're visiting websites, which websites you visit, how long you're there for. These are data that get stored on your computer or by a company that's offering you a service through the website. Certainly social media, if we're sending messages or posting pictures, those data are all stored, collected by a company. The things we purchase when we use our credit card, that produces data. When we use government services, certainly when we use healthcare. So these make data, they generate data, and those data, they go places. So companies that are building an app and that we use, those companies will store that data. When we use government services, governments store that data. When we use healthcare, healthcare organizations store that data. So, importantly, those data, they could then be used to build or adapt AI technologies. They aren't necessarily. Lots of companies are not prepared to build AI technologies or are not using AI technologies. But the data that we make in our everyday lives, including in healthcare, when they're collected and stored in large quantities with other people's data, then that creates a resource, sort of the fuel, the energy that can help to make AI technologies. So these are many ways that we make data. Now, what about healthcare? What about specifically in healthcare? What kind of data would theoretically help to make AI to be used in healthcare? And there are lots of different kinds. Things like our basic features of our identity, our age, our sex, gender identity, neighborhood where we live, diagnoses or health conditions you might have, family history or genetics, physical activity, mental health, visits to healthcare providers. These are all things that could be used to build or adapt AI technologies. So depending on where you live and the kind of record that your healthcare provider uses, some of these data may be stored and could then be used to build AI technologies. So I think this is an important piece that maybe people have not realized, but that actually things like our healthcare records, as long as identifying information about us are removed, it usually can be used. Legally, they're allowed to be used to build these AI technologies. So this is another opportunity for you to pause and think. Is that something you're comfortable with? Did you already know about that? And perhaps, depending on where you're tuning in from, this is something you might want to look into in your own region. Is that an allowed use of your health data for it to be, in an onward way, used to build technologies and insights that help to improve healthcare? So we'll pause, write down any thoughts or questions you may have, and we'll begin again in a moment. All right. So we'll move on to our third section of the talk around what is AI. And, as I'm sure you can imagine, it's difficult to find the right way in to answering this question because AI is a very diverse collection of technologies. It isn't really any one thing. And one of the things that I find confusing about AI, the way that AI is talked about in the media in particular, is this idea that we're on a search for a general AI or a super AI, that we're moving towards some kind of super intelligence that will be able to do anything we ask it. And I bring this up here just to acknowledge that yes, that's in the news headlines, and yes, technology leaders are talking about that stuff. But when it comes to healthcare, we're not talking about that in healthcare. In this session, I'm really just talking about something called narrow AI, which is the kind of AI applications that currently exist in healthcare, like the ones listed at the beginning of this talk, those specific uses of AI in healthcare. So from here forward in this talk, I'm just talking about something called narrow AI, which is just to mean the specific practical uses of AI that we have already introduced in this session. So answering this question, what is AI, is complicated, for a number of reasons. One of which is that it refers to the data that I've already talked about, where those data are stored, how they're shared. It also refers to, or can be used to refer to, hardware, like what we access on our phone. There can be AI in that. Uh, Robotics, certainly we think of some robotics as being sort of artificially intelligent. So that's kind of included, lumped together in our thinking about what is AI. Very importantly, it's math, statistics. Math is an important part of sort of under the hood of AI. But I think also technology companies that are defining the public conversation about AI, they're also an important part of what is AI. So we need to kind of sort out technically what is AI doing, but then in terms of what's important for you all, for us, uh, how does all this stuff fit together? Because when we ask questions about uh, is AI a good thing? Do we want this kind of AI in our healthcare? We're not just asking about the narrow technical definition of what the technology does, but rather about all this stuff, how our data are being used, what kinds of robotics or other hardware are being used, the math, the companies, and so on. So that's how we'll conclude our session today, is with some of those questions. Now, we do need to answer this question sort of technically, what is AI? So I'm going to spend some time on that now. And the definition that I will give comes from the World Health Organization's report on the ethics and governance of AI for health. This was published in 2021, but this definition remains a really good one. So they say that AI refers to the ability of algorithms encoded in technology. So we're going to pause here. Algorithms. What is an algorithm? And ultimately, an algorithm is just a set of rules or steps to be followed in planning or problem solving. So my daughters will eat scrambled eggs with cheese only in a very specific way. And I have an algorithm for making those scrambled eggs perfectly. I apply the specific set of steps, the algorithm every time to produce cheesy eggs that they will eat. That's an example of an algorithm, just a set of instructions to be followed to achieve a particular kind of output. So when we're looking at algorithms encoded in technology, algorithms for AI, that set of instructions is represented in numbers. So instead of it just being a set of steps in my mind, in order for it to work for AI, it needs to be written down in math, in a set of numbers. And I think it's interesting to look at the first ever published algorithm that was written with pen and paper. And this was by a scientist. Her name was Ada Lovelace. And she was the first to write down this set of numeric mathematical instructions that effectively is a set of instructions about what to do with new data that comes in. That's what this is, an algorithm about what to do with new data. And the purpose of the algorithm is so that is to respond to new data to be able to produce a better output. So we'll talk about this. So AI refers to the ability of algorithms, a set of instructions. This says encoded in technology, which just means built into the computer code that makes our computers run. So algorithms built into our computer programs to learn from data. And this language trips me up, learn, because what learns? Humans learn, dogs learn. The idea of learning implies like a brain, but that's not really what's meant when we talk about an algorithm learning. Really, what this is that the algorithm changes what it does in response to the data. When new data comes in, the data contains information saying this piece is more important than that piece. Then the algorithm can change what it does in response to that data. It's a pretty complex idea, but if we think of this as a set of instructions about what to do with data, that set of instructions can say, oh, more cheese, add more cheese to the eggs here. That's the feedback we're getting about how effective the algorithm is. We need to change the algorithm to have a more effective response. So the algorithm learns from data so that it can perform an automated task. And generally, the automated task is something that shows up on the computer. It helps to inform a decision, for example. And I'll talk more about that. But importantly, even if those automated tasks are a bit different each time, uh, AI helps to learn from data so that automated tasks, even with different inputs, can be done well. So for example, with an AI technology that helps to read a chest X-ray, the X-ray could be from a child, from an older person. It could be being asked about whether there's cancer here or for a different diagnosis like chronic obstructive pulmonary disease. So even where those specific tasks are different, diagnose this, diagnose that, uh, the new data that comes in, shaping what the algorithm can do, helps to perform those tasks better. And to say that the algorithm learns from data is really just to say that the algorithm changes what it can do in response to those data. And importantly, it does this without each little decision needing to be made by a human. So without every step needing to be programmed by a human. And this is really where the sort of magic of AI comes from, is that these algorithms, a set of instructions, can be modified over time as new information comes in so that they're better at automatically doing what they're initially intended to do. Now, there's a simple way of understanding this. If we're going to boil this down in the most fundamental sense, this is about statistics and lots of data and algorithms on computers. And when you add these things together, you get a prediction. And that idea of a prediction is really fundamental to my understanding of what AI is. And the way I understand that comes in large part from this book called Prediction Machines, written by some researchers in the School of Management at University of Toronto, that really nicely describes this for a sort of general audience. So if you're interested in some further reading about what is AI at the level of a book, this might be a good place to look. So what's an example here? Well, if we know that 90% of people with symptoms A, B, and C have type 2 diabetes, and you have symptoms A, B, and C, should you be checked for type 2 diabetes? So what's happening here is that we're using information we do have, that 90% of people with those symptoms have type 2 diabetes, to make our best guess at information we don't have, whether or not you have type 2 diabetes, right? So this is what AI can do really well. It's a set of instructions that helps us to make a prediction about what should be done next. And if you think about ChatGPT, perhaps that's something that you've interacted with or will interact with, where you type a question in and it responds very well in a very sophisticated way. It's just doing the same thing. It's predicting the best set of words in response to the words that you typed in. It's a prediction. ChatGPT is a prediction machine. So fundamentally, what is AI? It is an algorithm that learns from data or changes what it does in response to data to produce an output that makes the most sense given the information that it has. The better the data is that we give the algorithm, the better the response it will produce. So I'll pause here for a moment. This is a lot. And as I say, it's challenging to know the right way into this conversation because there are many ways to understand AI. Let's pause here, write down some questions or some reflections. I would love to hear your feedback about whether that was too much, just right, what you would like to hear more about, and we'll begin again in a moment. Okay. Here, this is just one slide as an FYI for your information. Here, I just want to point to a few words that you may hear in conversations about artificial intelligence. So this visual comes from an article, a research article, that's available open access. It's free to anyone. So if you see the title there, you can just type that title into Google. The article will come up. And in that article or on that web page, they have something called a supplementary file. There's a Word document there that has a detailed description of a educational program about AI for patient partners. This is a really great piece from some great colleagues. So if you'd like to dive deeper into this slide, or these ideas, then you could do that after the session. But here, this visual, really, I just want to show that artificial intelligence in that biggest circle refers to a whole big collection of techniques. And within that exists something called machine learning. Within that, something called deep learning. These are just specific kinds of AI. And that's all I wanted to say with this slide. Just so that if you hear those terms, machine learning, deep learning, you won't think, oh, is that something completely different from AI? No, they're types of AI. They belong together in the conversation about AI. And we'll move on to the fourth section and final section here of this session around why does it matter for you? So what does this mean for me? And here I wanted to introduce a set of questions that you may consider when you're thinking about particular uses of AI in healthcare. And, this happened. We see sometimes in the news or perhaps at our doctor's office or other healthcare facility, talk about some new kind of AI technology that's being used in healthcare. So when thinking, do you support that? What kind of influence do you want to have on how, whether and how AI is used in healthcare? These are some questions that may help. So, first, how is the AI model built and who is involved? One of the sort of core insights that has come from the past 10 years of AI development is that when you have a diverse group of people planning and building AI models, you get AI outputs that work better for everyone. So who was there? Who decided it was a problem that's important to solve? And who helped to build the technology? That's a really important question that frames the likely or the possible impacts that an AI technology will have. Second, what data are used to build the AI model? Have they used the right data? Have they used data from the right communities? These are really important questions around our rights, our data rights. Do we agree that a particular technology should be built using our data or the public's data? These are questions that we'll want to ask around our data protections and privacy. Third, what do they claim the AI model does? And already there have been some cases in the United States where companies were sued because they said that their AI technology did something that it didn't, that just wasn't possible. So depending on the kind of AI technology, if it's being marketed to us, here's the newest AI chatbot that will diagnose your, whatever your medical condition. Is that possible? In some cases, it isn't. So we need to bring a critical perspective to claims about what AI can do and about what a specific AI technology can do. What is the business model and how does a company make money? The rise of big technology companies has raised a host of questions about how much power these large companies hold. And how is it that they're making money? If it's through selling advertisements that then show up on our websites, what kind of advertisements are those? What ideas are being presented to us in relation to our health? This is a very important topic as we are all trying to sort out, what's the right, true health information, about public health, for example. How do I need to understand that? So thinking through how these companies that build AI technologies make money is an important part of this conversation as well. Next, what are the impacts of the model in real life? And this is the final question I pose here. AI is still new in healthcare. And although there have been research projects looking at what actually happens as a result of a particular AI technology, there's still lots we don't know. So have companies tracked that? Have they shown what are the impacts of an AI technology in real life? So again, something we may want to look into as we think about how we want to understand AI and advise about AI in healthcare. So let's pause here. This was the fourth and final section of the talk. I just have a concluding comment in the next slide. But think about this. Do these questions resonate? Are there other questions you imagine asking? What feedback do you have about these questions? And I'll continue in a moment. Okay, so I think that these questions help to represent us thinking about the ethics and the social impacts of AI. And I think we need to really keep that at the forefront of our mind as we're learning about these technologies. What do people claim they can do? Are they having a positive benefit? what other questions do we need to be asking as the technology develops? So with that, I'll say thank you so much for your attention today. And I would invite you to share your feedback at this email address, health.ai.feedback@gmail.com. Next steps will be to gather feedback, discuss it with Kadeen and Bernadette, community partners, think through changes to this presentation or other outputs that we might offer, and work on building those as a next step. So thank you again, and I look forward to hearing from you.